This is TWiT.
I think that what's happening in healthcare right now is we're seeing first-generation information technology systems that are automating healthcare. And I would draw a real broad, but I think useful analogy between manufacturing, where for about 50, 60 years, we've been using computers to increase quality, reduce problems with manufactured goods. And so the revolution in manufacturing that's gone on for many, many decades, to me in healthcare, we're at the beginning of that for roughly the last 10 years. And I agree very much with Lindsay that we're at a tipping point now. We're starting to see a sufficient infusion of electronic medical record software in enough hospitals and enough physicians' offices that we are coming to a tipping point, having more data, more ability to see how it affects health outcomes. But I also think we're in kind of the first generation of these systems, and it may take, the second generation of electronic medical record software and better interoperability among those systems, which has been a problem, even though it was very much a goal to have all these systems be highly interoperable. So we may not see some of the highly touted healthcare benefits until we go down the road another decade or so and have kind of the next generation of these EMR, electronic health management systems, be installed, and we get some benefit from the experience of the first generation systems and seeing how they work and how people can improve them, as well as improve the business processes of delivering healthcare around them.
Yeah, that's a really good point, Greg. And I'm curious as to, I know you look at the open source side of things, as to how you think as these systems develop, open source is being embraced. And maybe you should explain, I do think that our audience is fairly familiar with open source and its benefits, but why it's important that that be integrated and embraced as the systems evolve.
No, I appreciate that. Mostly, I think that the electronic health record market is an enterprise software market. And so some writing I did several years ago made me somewhat skeptical that free and open source software packages were going to do as well in an enterprise software market as they've done in some other areas. The flagship example, kind of one of the classic examples of very successful FOSS, is the Linux kernel and the various operating systems that are built on the Linux kernel. And that includes, the Android platform for half, 2/3 of the cell phones in the world. And so open source has been very successful. FOSS has been very successful when it creates a platform for kind of other technologies to build upon. It's also been pretty successful when there's some kind of support or maybe seeding of the technology by maybe a government agency or some kind of consortium. And this can take us to electronic medical records software. The Department of Veterans Affairs in the United States has for many years had its own internal electronic medical record system. That, however, has always been available as source code, and there's some companies, MedSphere is one example, some companies that try to use that system as a jumping off point to deliver kind of a hybrid product out in the general EMR, electronic medical records marketplace. But the EMR marketplace is really dominated by your traditional proprietary software vendors. And I think there's some structural reasons for that. The kind of care and feeding you need to give to a doctor's office or a hospital to have them install and use the software isn't typical of a lot of FOSS projects, which are great for developers who know how to go grab some code, use it, and deploy it, but maybe isn't so great for non-technologists like the staff you see in a typical hospital, particularly a small hospital or a physician's office.